On today's Hot Topic, we're going to discuss the treatments for depression as they pop up in your clerkships and on your exams. Now, the treatments for depression are really broad, but you'll never go wrong with cognitive behavioral therapy, which helps someone change their thoughts and their behaviors to improve their depression. Now, when it comes to pharmacological interventions, there are many different types of antidepressants. What's important to note for all of them is they cannot be given with a history of mania, hypomania, or in general, any sort of bipolar disorder. We could trigger them into an episode of mania or hypomania. Now, when it comes to pure depressive episodes, our first line is always going to be SSRIs, or selective serotonin reuptake inhibitors. This includes medications like sertraline, citalopram, and escitalopram. Our second line medications are going to be SNRIs, serotonin norepinephrine reuptake inhibitors. This includes drugs like duloxetine. Now, both of these medication classes, their main side effects are going to include sexual dysfunction and weight gain. So if a person becomes really distressed with these side effects, we might have to consider other medications. We want to make sure we choose the best drug that fits the patient's criteria. So in a person who has sexual dysfunction, we might want to consider two other drugs, mirtazapine and bupropion. These two medications actually decrease the chances of sexual dysfunction. Mirtazapine helps with depression, reduces the chances of sexual dysfunction, and it also helps with insomnia and poor appetite. While on this drug, people might actually gain weight in a beneficial way. With bupropion, this medication is great for depression as well as reducing sexual dysfunction, but it also helps with smoking cessation. So if you have a patient who wants to quit smoking, bupropion is a great choice. Now, we want to be careful because bupropion can actually increase the risk for seizures, so we don't want to give it to patients with epilepsy or an eating disorder like anorexia. Now, let's consider other situations. Like we said, mirtazapine helps with sleeping. There's another drug that also helps people who have depression and insomnia, and that's trazodone. Now, let's consider chronic pain situations. If we have a patient who has chronic pain, neuropathic pain, or neuropathy in the setting of depression, we might consider an SNRI, like duloxetine. Now, we can also consider chronic migraines. Patients who have these recurrent headaches and depression can also be treated with TCAs, specifically amitriptyline. TCA stands for tricyclic antidepressants, and these are a really broad class of medications, but amitriptyline is known for its migraine prophylaxis. While there are a lot of different medications that can be used for depression, some patients don't respond to any of them. And in patients who have resistant depression, who have impending suicidality, whose life is in danger because they're not eating or drinking from their depression, we also have to consider electroconvulsive therapy. This is the last resort, but it basically induces a seizure through the brain while under anesthesia to help treat the depression. Again, it's a last resort. So let us know what you think and if this is going to help you out on your clerkships.